Hi, I'm Rhonda Pick, Managing Editor of Pig Health Today. Joining me is Dr. Alyssa Betlach, Swine Veterinarian at the Swine Vet Center. Welcome.
Thank you for having me today.
It's great to have you join us and highlight some of the new research that you're presenting at the 2020 American Swine Veterinarians Annual Meeting. You have spent quite a bit of time at the University of Minnesota previously looking at MHIO. Tell us about some of your recent research that you've been doing with surveillance protocol.
Yeah, so currently at the University of Minnesota, still working on graduate schooling. I am working on Mycoplasma hyopneumoniae, and so a lot of our research is focused on surveillance at this time, and my research more specifically is focused on replacement gilt populations and really ensuring if there was a recent introduction of Mycoplasma hyopneumoniae, would we be able to detect such introduction with the commonly utilized practices we do today.
And why is the focus on the sow herds so fundamentally important in the discussion?
Yeah, so if you think of a pyramid, right, the sow herds are at your top of your pyramid. And so everything flows down from there. And so gilts and sows are a critical aspect at stimulating and perpetuating that transmission of Mycoplasma hyopneumoniae. And so it's really important for us to minimize the introduction and ensure that we have a negative health status in our herds to reduce the cost of Mycoplasma hyopneumoniae in finishing and then the economic impacts that it has with production and health.
MHIO has been around ever present, and the costs kind of range from like $1 a pig all the way up to like $10 a pig when there's co-infections, right?
Yep,
exactly. Are those numbers still pretty accurate?
Yes, yep. Those are the numbers that we know of today. And I know people are still currently working on really identifying what that value still looks like.
So tell us a little bit more about what kind of protocols you were looking at with your most recent research.
Yeah, so within replacement gilt situations, we commonly use blood or oral fluid samples, and that's mainly due to cost, feasibility, and you can detect for multiple pathogens. And so with that in mind, there are also several other sample types for Mycoplasma hyopneumoniae, such as laryngeal swabs and deep tracheal catheters that are more sensitive. And so we looked at comparing those and really understanding the differences at time which you could detect Mycoplasma hyopneumoniae and the sensitivity.
And are we better at detecting, how are we at detecting acute issues in particular?
Yeah, so it really ranges on the sample type that you're going to use. And so deep tracheal catheters are more sensitive compared to blood samples, for example.
Okay. So tell us a little bit more about what you were finding as far as your recent research results.
Yeah, so for our research, we introduced a naturally infected gilt within a naive population. And so over time, we actually could appreciate that there was one new naive gilt that became positive at 6 weeks after contact. So you can appreciate that there's this very slow transmission of Mycoplasma hyopneumoniae compared to other pathogens, for example.
So based on your research findings, what recommendations do you have to producers as far as, what is most effective with their MHIO surveillance?
Yeah, so if you really want to focus on Mycoplasma hyopneumoniae surveillance, it is really critical to have a more pathogen-specific sample type. And so what I mean by that is using deep tracheal catheters or laryngeal swabs to really make sure that we have more accuracy in ensuring our diagnostic capabilities for detecting Mycoplasma hyopneumoniae compared to oral fluids or blood samples.
Are there any drawbacks related to tracheal swabs?
Yeah, so taking tracheal catheters do require more practice. It's a newer technique. Other people are not used to taking such sample type, and so it does require training and practice. So
but the upside is more accuracy.
It's more accurate, yes.
So with existing ways that surveillance is done traditionally through oral fluids, where does the opportunity really exist to be introducing some of these newer methods with tracheal swabs and that sort of thing?
Yeah, so if we really want to increase our ability to detect Mycoplasma hyopneumoniae, we really need to really have a different mindset and focusing on more sample types that are more sensitive for detecting such pathogen. And so those are more focused on deep tracheal catheters as well as laryngeal swabs in comparison to blood and or oral fluids. And so within our study, we did appreciate that there was a very slow transmission of mycoplasma. And so if you have a naive population, like in a GDU, and you introduce one gilt, it does take, in our study, 6 weeks in order to get a new infection. And so you can appreciate the really the slow transmission, as well as the inability to detect Mycoplasma hyopneumoniae. In regards to the natural cedar that we introduced, we could detect it all the way through the study. However, with blood samples, we couldn't detect it until 6 weeks. So you can appreciate, even with our known positive, we couldn't even detect it that way. So the biggest thing is really understanding the sample type you want to use, the limitations with such of a sample type, and then also you could think about even extending your isolation period if you want to take a different sample or less sample sizes.
So what lies ahead with your future research endeavors? What are you most excited about?
Yeah, I'm excited to just continue my work on Mycoplasma hyopneumoniae, and really what we're looking at in the future is trying to get a better idea of a benefit-cost analysis, and so really understanding what's the risk of an introduction, and with time sampling several gilts, what does that look like cost-wise, and then in comparison to if an outbreak were to occur, how much we would save if we were to perform such more accurate surveillance strategies.
Sounds like there's always more work to do in
Of
the
course.
Ohio camp.
Of course, yes.
We've been visiting with Dr. Alyssa Betlach, swine veterinarian at the Swine Vet Center. Thanks for joining us.
Thank you.